Healthwise, brought to you with the compliments of ICBL, always there when you need us most. Hello, good evening. Thanks for joining us on Healthwise tonight. We'll start our three-part look at sickle cell disease, also called sickle cell anemia. Now, it's an inherited condition passed on when both parents carry what's called the sickle cell trait.
If they get the sickle cell gene from the father and the normal gene from the mother, they can be sickle cell trait as well. But if you get both genes from both abnormal genes from your parents, then you would be sickle cell anemia. So with every pregnancy, there's a 25% chance of the baby being born with sickle cell.
And that genetic mutation is what causes the problem.
It gives the shape of your red blood cell a sickle shape, sickle like what they used to cut grass. It has that shape. And because of that, that's abnormal. The normal cell usually has like a more spherical shape, and it's shaped like a donut, the normal red blood cell. And the normal red blood cell is very easily pliable and to go through the blood vessels.
And this is key with sickle cell disease. Because of its sickle shape, the blood cell becomes very rigid and fragile, sticking to the blood cell.
It's very fragile, so it breaks very quickly. And because of that, you get the blood cell life is shortened. Normally, red blood cells have a lifespan of 120 days. With the sickle cell, they can be 30 to 60 days, so it can be half or a quarter of what the normal lifespan is.
One of the biggest complications of sickle cell disease is the anemia that is added to the name of the condition.
You get anemia because your red blood cells are less than normal because they keep breaking down. The other thing that you get because of the breakdown is that you get yellowing of the eyes, or what we call jaundice. So you see a lot of patients who have sickle cell disease are usually like jaundice. But the major problem with sickle cell anemia or sickle cell disease is that the pain the patient, and that is basically the bane of a sickle cell patient's life. The pain that comes with it because of it sticking in the blood cells and causing the the organs or the tissues to die, that is what causes the major problems for sickle cell patients.
We'll get back to the discussion on pain and its implications for sicklers in our follow-up program. In the meantime, however, the anemia that these patients develop is somewhat different to those who are chronically anemic. What makes a difference is the symptoms.
They might be pale looking, and they may have an increased heartbeat because there are less cells to go around. So the body has to, the heart has to work a little harder. So they may have a higher heart disease. Their blood pressure might be a bit lower than in the normal range. And some of them may have what we call a murmur, which is an added song in the heart, which is just because what we call a flow murmur, which is just because of the increased flow, because of the chronicity and the heart trying to get out the blood into all the tissues.
We'll wrap up tonight's program with a look at the Barbados situation. According to Dr. Alexis, a study was done some years ago on 1,000 babies, the results of which showed a 4% prevalence rate for sickle cell disease in Barbados. She anticipates that this figure has not changed much, if at all, over the years. And that's tonight's program. Thanks for joining us. Healthwise, brought to you with the compliments of ICBL, always there when you need us most.